evening, ladies and gentlemen. My name is Esther Yesutor Agbozo from Ghana, and together with my partner Rodney Ngoh, we have put together an overview of the cultural aspects of mental health in Ghana. We will also touch on stigma, mental disease prevention, diagnosis and treatment of mental illnesses in Ghana, as well as advocacy and financing with regards to mental health in Ghana. I must say that some decades back, the mere mention of mental illness in our country was like a taboo. And the reason was that people believed that anybody who had a mental illness was suffering from that mental illness either because they were possessed by an evil spirit or they had been cursed spiritually because of an offense they committed. Sadly, this is still what a lot of people believe even up to today. For this reason, people with mental illnesses were isolated in very, very unfriendly environments. Some of them were chained, beaten, starved for days, all in the name of trying to cast out the demons that were causing their mental illnesses, and they were exposed to all manner of inhumane practices. Now, some years down the line, the narrative has changed, not entirely, but to some extent. Since the establishment of the Mental Health Act of Ghana, Act 846 in 2012, the rights of persons with mental illnesses in Ghana are being protected under the Act. And so, the level of exposure of these persons to such inhumane practices has reduced to a bare minimum. However, there are still people who are experiencing these things. And the reason is that a lot of people in Ghana and I think Africa at large believe that mental illnesses have a spiritual connotation to them. Now, we are saying that in as much as this is the picture that we have in our country, we believe that all hope is not lost. People with mental illnesses fail to voice out about their conditions, and in effect, they fail to get treatment because of the stigma and the discrimination that exists against persons living with mental illness in Ghana. I believe that this is the picture not just in Ghana, but in Africa and even the world at large. For this reason, we believe that if we tackle the prevention of mental illness using the 4 levels of disease prevention, it would go a long way, not just improve the figures in Ghana, but the figures in the world at large. Now, the 4 levels of prevention are primordial, primary, secondary, and then tertiary. And the primordial prevention, we believe that there has to be a review of the Mental Health Act of Ghana, which is Act 846. We are saying this because we believe that a review in this act would make more room for deinstitutionalization of mental health care, as well as more focus on community-based mental health services. Again, we believe that under primary prevention, public education of the masses in schools, in churches, in the mosques, as well as all public gatherings would go a long way to improve on the wide knowledge gap that we have. And if the wide knowledge gap is narrowed, this would interpret into a narrow treatment gap as well, as more people would be ready to go for treatment, since the stigma and discrimination that exists against mental health patients would reduce to a bare minimum. Under secondary prevention, we believe that regular screening exercises for mental health conditions in various communities in Ghana would go a long way to help with the early detection as well as the treatment of mental health conditions to prevent complications that come with these conditions. Now, under tertiary prevention, we believe that there has to be establishment of more rehabilitation facilities in Ghana. Right now, as we speak, we have just 3 main psychiatric hospitals in Ghana, 2 of them in the Greater Accra region and then 1 in the Central region. Each of these psychiatric hospitals has a rehabilitation center. Now, Ghana has 16 regions. Now, the question is, 3 regions have been covered with regards to rehabilitation facilities for complications with regards to mental illness. What happens to the other 13 regions in Ghana who have no rehabilitation facilities? Some of these regions don't even have any psychiatric facility at all. Some of them luckily can fall on the psychiatric department in the regional hospitals found in their regions. For this reason, we are saying that the establishment of more facilities for rehabilitation for persons who have developed any complications whatsoever due to their mental illness would go a long way to not only reduce morbidity but to also reduce mortality that comes as a result of mental illnesses. We believe that all this can be done through appropriate and adequate funding. Investing in mental health now means that you are investing into the future, because mental illnesses tend to reduce the productivity of individuals, and the productivity reduction of an individual will translate into productivity reduction for a nation. And so if we are investing in mental illnesses now, we believe that in the future we are going to reap the benefits of the investments that we are making. Unfortunately, in our country, only 1.4% of our total expenditure on health is spent on mental health. Just 1.4%. This is really, really appalling and woefully inadequate. And so we are urging the health minister and the entire Ministry of Health to review this figure, not only to improve on the mental health services in Ghana, but in Africa and then the world at large. We believe that more can be done in every country, and Ghana is no exception. We are saying that it has been established, and we all understand that there is no health without mental health. And so we all need to take action to change the situation and change the narrative of mental illnesses. We have made some progress since 1990, but we believe that there is more room for improvement. And the time for us to make that change is now, because countless number of people are out there suffering, and countless number of people are out there who are voiceless because they are being stigmatized against, and they can't even voice out because they are scared to be teased or laughed at by their loved ones. They are scared to lose their jobs, and they are even scared to go for treatment. We also want to use this platform as an avenue to advocate to all other nations and organizations that are capable of supporting our motherland Ghana to come to our aid with regards to mental health. If you can support us in any way, as a member of the European Union, we want to appeal to you to come to our aid. As Ghana is a lower middle income country, we do not have all the muscles that we need to be able to fight this menace alone. And so we want to advocate that all members who are capable of supporting us in any way possible should do so. And at the end of the day, we believe that the narrative about mental illness in Ghana would change, and then the future generations will not have to go through what this current generation and the past generations have experienced. Thank you very much, ladies and gentlemen, for your time and attention. Have a good evening.